Hello, and this is the Menopause and Vitality. I am so glad that you are listening in. I'm so glad that you are so interested in such a wonderful topic. I have done this education for 30 years now, and I am so grateful to be able to present this information to you. We're going to be talking about lifestyle, menopause, and vitality. So what I really wanted to do was to give you all like this science of feeling like yourself again. Because when I was meeting with a group of women today, and I do hear this, and I have heard this for years, where they say, I just don't feel quite like myself. And I'm going to dive into some questions at the end of this, and I'm going to take 10 of the most popular questions that are asked. And then at the very end, I am going to present you with a beautiful opportunity so that you can actually meet with me. Because if you're feeling something like this is like for me, then I want you to know that I am happy to talk. So, hello and welcome. And I am just so appreciative that you are watching. If you're watching this on replay, if you're watching this on social media, I'm glad that you're here. Well, if you don't know me, please let me introduce myself. My name is Connie, and I am a registered nurse. I'm a holistic women's wellness naturopathy practitioner. That is a really long title. Really, I love holistic because I think outside of the prescription bottle, naturopathy, even though your test results may come back however they do, I already know that I am looking at things that have seen the Lord's Son. I am looking at products. I am looking for ingredients that are perfect for what you have going on because I know that for medicine, they do their thing, but I know for me, I still do science backed practicing. There you go. So I am specialized in helping women in navigating perimenopause, menopause, and postmenopause. I do help you all do this with clarity and without confusion. I have been told this about myself is that I can take the hardest things and make them easy. But just so you know, the other flip of the coin is yes, I can make easy things. It's just like I don't know, I don't even understand. So there you go. That's just me. So today we're going to be talking about why so many women reach the point to where they say, I don't understand what's happening to my own body. So if that's you, you're not alone. You haven't been alone. It's not, the story hasn't changed. It's over time women have said this, okay? But I do want you to know that you're not imagining it, okay? And that's always really nice because let's just take a deep dive into some validation, okay? So I hear from women who say things like, I used to feel energetic and now I'm exhausted. I do feel like when I'm speaking to clients, this is the culmination of what I hear. I wake up tired. And I'll see on social media where some people will say, oh, you know what? You're a mom and it's just so hard to be that way. Well, are we dismissing some things that we may have going on? So, I mean, you've got someone here with a trained mind, and I really love to see if we can break down some other symptoms that could be what you're experiencing, and then we're gonna take a deep dive into things that I suggest. Okay, what about gaining weight? I'm gaining weight, but I'm doing the same things that I've always done, and I don't understand why I'm gaining weight. My sleep is terrible, my mood is different. I do have clients who say, oh my gosh, I used to be so sweet and so nice, and now it's kind of like I don't understand why I can't stand the voice of whoever's in the home or whoever's talking and chewing and crunching, whatever. That might have been how you've always been, but I will say that there are some times when that mood, it just shifts and everyone in the house knows it. All right. What about my joints hurt? And then you'll see something in the social media comments, you'll see someone with all these different links and all these different suggestions. Y'all, hang tight. I'm going to tell you some things. What about hair thinning? What about my doctor says that my labs look normal, but I still feel like poop? Okay, I understand. Now, if you've been told this, that's just aging, or because you're this age, this is what you should do, it can absolutely feel dismissive and discouraging. Well, because you've hit this landmark right here, we need to put you on this. Okay, well, when we get to the question and answer part, I just I can't wait for you all to see the responses that I have given. Now, I do want you to know that how you're feeling is not, it's not random, it's because. Okay, we need to find out what is the because. What is the biological, hormonal, what is the very real thing that is going on? Okay, besides you being in the waiting room of social media, I call it the digital waiting room. If you need to go and hear a beautiful podcast, I did a 10 series of that on Spotify, Self Care University. Okay, dive in there and check it out. All right, so now what's actually changing? Hormones, they don't just control reproduction. Okay. So women who are between the ages of 30s and 50s, 20s and 50s, when you start to think, okay, hormones are doing this and they're doing that, and then I'm no longer going to need them whenever I hit 50 because I'm no longer going to be at risk of getting, not risk, but in the realm of getting pregnant because here we go, it's just going to be smooth sailing. Well, just so you know that your hormones, they influence every single system of your body. It includes your metabolism, your brain function, your mood, your sleep, your bone health, your skin and hair. It also can affect your heart, inflammation, and blood sugar regulation, which is why I say that when someone is in the chat section and they are ready to pounce on your question with what they were told by their doctor to do, their medical professional with what to do. I even say this to my clients. This is tailored to you. When you are on social media and you see someone with the same symptoms as you did or you do, it's not going to be the same treatment. We're going to talk about why, okay? Because during perimenopause, the hormones, they will just do this decline nice and smooth, okay? Nice and smooth. Not, nope, they fluctuate. See, that's the thing. When social media, this is the facts versus the fiction is that okay, well, when you're this age, this is what happens. And when you're here, this is what's supposed to happen. Now I get it. We do have to have a true north compass, like kind of when is perimenopause and kind of when is menopause and what in the world is postmenopause and what am I going to get there? Okay. But just remember this time, those hormones during perimenopause, they are very much fluctuating, and we can feel happy and we can feel sad and we can feel like there's this 10 years of feeling like this certain way until we got to a particular point of where we're like, I'm going to get some help, I'm going to get some answers, and then you felt human again. I've heard it. Okay. Estrogen may spike and it may drop unpredictably. I will also say that if you have had a baby, like pregnancy, and you delivered the baby, or okay, there is this crash, this hormone crash that happens. I am very much of the mindset that if you have a baby, to make sure that you have a very good support system. And if you are that support system, ask questions, not probing. How are you doing? How are you feeling? Listen, provide productive support instead of, well, whenever I had my baby, I did this and I felt that way. Make it about the mom. Okay. If you've had a surgery on your reproductive parts, okay, you could find yourself going through a hormone crash when things could be going haywire. This is the time to ask for a medical provider's opinion. This is not the time to have your first place is on the social media webs asking for assistance because everybody's going to come at you with their I statements. Okay. This is about you and asking you questions and make sure that you are supported. Okay. Progesterone, it often declines earlier. If you are finding that you are in the reproductive phase of your life and you didn't even know that your progesterone levels were low, and you are finding yourself in this phase of going, oh my gosh, why can't I get pregnant? Why am I having losses? What's happening? These are parts of when you will say, I recommend that you see a medical professional. I've heard about this, and I really feel like you I I really feel like this is the best place to have a medical professional answer your questions. Instead of saying, what herbal remedy did you do for this? And then you go in there and then somebody's just pouncing away. Supplements have their place. Supplements have their place. Remember, I said I go for products that have seen the Lord's Son. I do, because there is a time for that. But just be mindful, y'all aren't over here asking what else are they taking? How are their kidneys? How is their liver? Okay. So testosterone, oh my gosh, that changes as well. Your testosterone could be here, your progesterone could be zero, and your estrogen is like, I don't know what's happening. What are we doing? I'm just so upset and I want to cry. And then I'm really mad. I love everybody, right? These fluctuations, they can affect how your brain and your body and your nervous system functions day to day. You could be working with someone who is going through hormone changes. You could be the person that is going through hormone changes and can be feeling like you are having a midlife crisis at 20. You could feel like you are having a, I don't know what in the world my body is doing at 60. Okay. And perimenopause can begin in the late 30s. It can happen in the 20s. Okay. But it can also happen in your early 40s. And like I said, sometimes earlier. But you do not have to be in full menopause to experience these changes. All right. I will tell you, I have used the term menopause loosely. When have I used the term menopause loosely? Is when I've said I'm a menopause coach or I do menopause education. It doesn't just mean that I'm doing that 1 year without a menstrual cycle. No, it's just something that women understand. Men, if you have questions about menopause, I have heard it said that it is menopause and it is very real and it is something that I'm still going to tell you, seek medical professional advice. Get the hormone testing done. If you have a question for me, should I do a blood test? Should I do a Dutch test? Which Dutch test should I do? I would love to answer those questions for you. All right. So this is why the one size fits all advice fails. Okay. Because I promise you, and I know you do, I know you want someone to see the link in the comments. I know that you want someone to see the name of your special product that you have. And I bet it is amazing. But here's the thing, ask questions. Link comes later. Link comes after you have understood what they need, because trust me when I say better is a client that understands why they're taking the product, what is it for, what did you hear them say, and how long should they be on it? Should you be on protein forever? What about collagen? When should I start on collagen and when should I not be on collagen? I understand there's education out there. Okay. There is so much education out there. But if you already have a product, you already know who it's for and who it's not for. Okay. And there's other people that are pouncing inside those comments to go, oh my gosh, hormone replacement therapy. I want to see what is happening here. Hot flashes, what do we do? Okay. But I'm just going to tell you that women are told, seeing this in the comments, you just need to eat less and exercise more. You need to reduce your stress. You need to take a sleep aid. Here's my link. Here, take this sleep aid. It's going to be the super, super bestest for you. I don't know anything about you, but this is going to help with sleep because I know it does. All right. Or just push through it. But the reality is that multiple factors they do interact. Hormones, sleep qualities, stress hormones, nutrition, muscle mass, nutrition, gut health, other medications, prescription and supplement wise, genetics. What about life demands? Could you imagine? Could you imagine? Now, just hear me when I say that two women the same age can have completely different experiences because their bodies and their histories, they are completely different. If you're talking about twins and different things like that, y'all, that's a completely different story. But what I'm saying is Miss Anonymous inside the social media webs has an issue, and you are Anonymous 123, and you are going to come in and you're going to give her the 411 on what you've been told because you know, right? Just be mindful that you could be the same age and just have completely different experiences. Well, why? Because you're individual. You are completely an individual. Okay. Well, there's hope. There's hope. So the encouraging news is that your body is adaptable. I have always heard the term that nurses should be flexible. But I would love for us women to know that we can be adaptable. And you probably feel like you already are, but I'm just going to give you some small targeted changes that can be meaningful improvements in your energy, your sleep, your mood, your weight stability, your cognitive clarity, and oh my gosh, overall quality of life. One thing that I've heard in nursing and outside of nursing is quality of life. This is what I have heard is that when you're dying, they just want you to have a good quality of life. What is your quality of life when you leave this world? Oh my gosh, please, um can we go back a little bit to like what about quality of life when we're in our 20s? I want quality of life in my 40s. I want quality of life whenever I'm 60s. I don't want to wait until I'm on hospice for someone to start my QOLs. Okay? Because some women benefit from lifestyle adjustments alone. Some explore these medical options with their physician who listens to them. Okay? Some need to address these underlying issues that were never evaluated and no one's asking you on the social webs. Okay? You do not have to guess your way through the stages of life. And no, you don't have to suffer silently. I have clients who have said, I've been going through this for 10 years and nothing has changed. And then when they meet with me, we do their hormone testing and then they do their protocol and they're like, I feel like a human being again. Man, what a buster to know that she waited 10 years to do this, to find herself to that point. Okay. So I would love that if you are thinking and listening and you're hearing this and you want answers about your situation, you don't want to wait the 10 years. You don't, when we are waiting the 10 years, so many things have gone on. Okay. What I would love to invite you to do is when you notice it, sometimes it's already been a year or 2 years or months. Okay. I'm just going to tell you, I do it, get it done. So you all will receive in the link, you all receive a free 20-minute consultation with me. And I would love to talk to you about your needs, what you've got going on. And just know it's not diagnostic care. It is a guidance session where you can ask me questions and you can learn what options are appropriate for you. Okay. I am a registered nurse. I have my bachelor's degree. I've been doing this for 30 years. I've been doing education and public speaking for longer than that. and I appreciate what I do, and I appreciate you taking the opportunity to listen, because I'm going to ask questions. Okay. And that is where I'm at. Good on you if you are a company that provides helpful tools for supplementation. Good on you. I love it. You will never stress someone out with the benefits. Never. You will never stress out someone when you say, I have questions. Can we talk? These are the benefits of this product. I hear you say this, and these align. So, what I would challenge you with is come forward with the benefits when you know the questions, and then they answer them and you get that feedback. Everybody wants to make money. Everybody wants a commission. I get it. But you will have a client for life when you know that you didn't waste their $39.99 on this product, when this one over here was $59.99, and it would have been better, and they would have been on it for a shorter term rather than going over here and spending $29.99, and it didn't even cut it. Okay. So this is just that's just a helpful little tip there. All right. So we've got some questions. Remember, this isn't medical advice. We're just having a conversation. So if this is the part where you want to pause and do your thing, then here we go. But I'm going to keep on going. Here's the first question is, why am I gaining weight even though I'm eating the same? I hear you. You're like, I used to could eat a pizza. I used to could eat a taco and it not be a big deal. I used to could eat a salad and not gain weight. And now I look at ice water and I gain weight. Okay. But let's just be super mindful that it is a common concern that I do hear during perimenopause and menopause. Okay. It's that estrogen that's declining and the body becomes more insulin resistant. Okay. These are common. I'm not saying that's you. Okay. I'm just saying these are common, meaning that it stores calories different, especially around the abdomen. I'm not saying that everybody who has fat around their abdomen or adipose tissue around their abdomen has hormone issues, but let's just, keep our eyes to ourselves. Okay. Ask questions if they want your opinion. There you go. Now, at the same time, we can also notice that there is this muscle mass that is decreasing, could be decreasing naturally. We're not holding the babies. We're not, pushing the stroller. We're not carrying in all the groceries. We're starting to do less. Our muscles are starting to become more dense. So I just want you to know that can also, when we have that natural muscle mass decreasing, yeah, we can also see a lowering of our metabolism. I'm not saying that's you. I'm just saying it could. Okay. Now, it is usually not a lack of effort of you trying to do your thing. Okay. But there can be this shift in how the body processes fuel. Here, when I talk to my clients, I always say, do you want to push the car or do you want to put good fuel in it? Okay. Because you can push the car, you can use a lot of effort, you can be super exhausted and tired because you're pushing the car, because you're not putting good fuel in there. But if you put good fuel in there, the right fuel, there you go. Oh, let's have a conversation about processed foods, but we'll have that at another time. Now, the strategies do work in your 20s and 30s, okay? But just remember that we're starting to get into that perimenopause, we're starting to get there. We are going to see that we're going to need to do some changing. Okay. What about protein support? What about strength training? What about sleep? Quality sleep, right? What about lowering our stress level? Okay. What about that blood sugar balance? Those can make significant differences here. Okay. This is another big one. What about the hair thinning or falling out? If you're on a GLP-1, I do want you to ask me a question about that for sure. But if you're not on a GLP-1 and we're starting to get into like our 30s and 40s and we're wondering why is our hair thinning and why is it falling out? If you're in your 20s, I can answer the question for you too. But if you're starting to get in your 30s, 40s, 50s, we're having the hair thinning, just remember that it can change for several reasons. Because just remember, declining estrogen and progesterone, they do allow effects of these androgens like testosterone, okay? They can become more noticeable. Now, the thyroid function, let's ask questions about that. When's the last time you had your thyroid panel done? Also, make sure you ask someone like me whenever you are going to have your thyroid level checked. There is a specific time of day to have the thyroid checked. There is a specific state of mind when having your thyroid checked. Your primary care doctor is probably like, I've never heard of this in my life. Well, this naturopathy RN has, and I share it with my clients, and they love it, and it is fantastic, and they get their true results. What about iron levels and stress hormones and those? What is your nutrition status? We're also talking about the GLP-1s. What are you noticing since that? Okay. Also, hair loss is not something that you just need to accept. Okay. It is it's, you got to look at the whole picture. What's happening? Ask questions. That's why I said ask questions, because I'm really not sure that there's just one single cause. Okay. All right. 3. Why do my joints all of a sudden hurt? I go like this. What in the world? This frozen shoulder. Why does it feel like I have something in my, like a scour pad in my shoulder blades? What in the world is happening? Or my knees or my back, or what in the world's happening? Why do I all of a sudden, does this make sense? Just remember that estrogen has an anti-inflammatory and proactive effects, okay? Or protective effects, not proactive, protective. Estrogen has an anti-inflammatory and protective effects on the joints and connective tissues. When we start to see that decline, some women can experience stiffness, aches, or what feels like this accelerated aging overnight, where you feel like you went from 20 to 50, where you started to hear yourself going, whenever you stand up. Okay, well, let's ask the question. What is your sleep quality? What is your activity level? Hydration? Do we like water at all? All right, what about muscle strength? What about that inflammation? What in the world is contributing to that inflammation? Are you on a high processed food diet? What is happening? Okay. Just be mindful that gentle movements, strength training, and anti-inflammatory nutrition, those can often help reduce those symptoms. Okay. Well, we talked about this earlier, but I told you I would mention it in the questions is why can't I sleep anymore? Like I used to go from like, oh man, I could sleep like 12 hours, slept like a baby. What in the world is happening? Okay. Well, sleep disruption is extremely common, can be, and it's often multifactorial. Lots of different things. I just don't think that what's going on in your system or in your body is just like, that's the one thing. Let's throw this product at it and it's going to fix it. Yeah, we're going to give it two months. Get on the subscription. We're going to be on there for 2 months and we're going to see this change. Well, there could be other factors that are going on. Okay. So, well, just remember that hormone fluctuations, they can affect the brain's sleep center. Okay. It can affect your body's temperature regulation. I hear people all the time say, why am I all of a sudden so cold? If you're on a GLP-1, I'm going to ask you a question. Have you had your thyroid checked? If you're on a GLP-1 and you've been on it for 3 months, have you had your thyroid checked? Or before then, there are just so many other questions to ask. Okay. What is your stress level like? Cortisol levels, what is happening? Okay. What about night sweats, anxiety, um, blood sugar swings? Like you wake up and you feel like you could eat a ginormous breakfast because you are, or at night you get these sugar cravings. Do you see what I'm saying? It could be very, very different. And I just want to just let's check those progesterone levels, okay? Because we want that calm, okay? We don't want anything interfering with our sleep. We want to improve that sleep hygiene, stabilizing that blood sugar, okay? Managing that stress, whatever that is. I'm not saying manage that stress with harmful products. I'm just saying manage it. What is it? Who do you need to delegate to? I say this to my clients. I say, why don't you give to someone who can do this 80% better than what you're doing 20%? When you think that you can multitask, when you think that you could spin the plates, and you are doing so fantastic because you're used to being the one that does all the things, my question to you is, which plate that's spinning can you give to someone else because they can do it 80% better than you are doing 20%? Okay. Those hot flashes, let's just, I don't know, what in the world? Okay, do we have to live with it? The answer is no. No, you don't have to live with hot flashes. And I say this, hot flashes are not a rite of passage. Something is going on. We need to get it figured out. You can't just live your days in bamboo pajamas and bamboo throw blankets that you know, I just love so much. Okay. But just remember that many women find ways to reduce both in frequency and intensity because hot flashes, they can be related to the changes in the brain's temperature regulation system that can be influenced by estrogen levels. Are we on a contraceptive? Are we on something that is, what are we on? What are we doing? What are we gaining weight? What is our estrogen level doing? Okay. Just just remember that we do not have to live this way. What's happening? Do we have increased stress? What about caffeine, alcohol, spicy foods? I mean, how's your sleep? Do you have those blood sugar swings? All right. What about your lifestyle? What can be adjusted? What medical options are available for you? If a natural supplement is perfect for you, I'm always saying that that's more bioavailable. If it's something that's perfect for you right now to try, ask your provider about it. Okay. What is right for the individual is the best approach. This one makes me a little sad, okay? Is why do I feel anxious or emotional for no reason? This is the part where like we're best friends with everybody, we're so sad, and you've got someone coming to your cubicle and you're like, "What's wrong? You okay?" And you're like, "Yeah, I'm fine." You're not imagining it. Hormone, those hormones influence the neurotransmitters like serotonin, sorry, or GABA, okay, which can regulate the mood and calmness. We've got this fluctuating estrogen and progesterone that can make the nervous system more reactive, where we can find ourselves going, I'm just crying. Like, I don't, what in this world's happening? Here's some things that I would ask you, okay, who asked this question. When you are sleeping, are you getting that good quality sleep? Okay. And what about stress? What is happening? What are some things you can delegate? This emotional resilience. Okay. You can just really feel like I have nothing left to give. I have nothing. My tank is empty. I can't even read a book and feel empathy or sympathy. Okay. But just remember, get supportive nutrition, get stress management, sometimes counseling. Oh, I have suggested many a time a counselor, even to clients that have asked me about weight loss. I'm not a doctor, but just remember, my job is to listen, to educate, tailored to you. Okay. If seeing a psychologist, a licensed practicing counselor, neuropsychologist, what in the world? What do you need? Let's get it. Okay. But just be mindful that I'm going to ask you, what have you tried? And let's go from there. We need that balance restored. Should you get hormone testing? There is always a reason to get hormone testing because you are asking. It's almost a question. Should I call 911? Well, if you think you should call 911, what is happening? You know what I mean? What questions do you need answers to? Okay. Because that it can also depend on your symptoms and your goal. If you are in that 10-year period and things are doing the things, yes, absolutely. I'm going to 100% of the time suggest that you get testing done because peace of mind is worth $1 million. Okay. And a test costs way less than that. Okay. It can be helpful in certain situations, but there is not one single test that's going to tell the full single story because those hormones fluctuate. But I will tell you, blood test is like this. It's going to take a snapshot of me right now in this moment, how I'm doing. I love the Dutch test because I'm getting to know what I'm like in the morning. If I wake up early in the morning, if I wake up in the morning, when I wake up in the morning, all throughout my day, I'm getting my tests. I'm testing, and it's not invasive. It doesn't hurt. There's no blood involved. You know what I mean? And you do it yourself in your own home. It's so great. And then you're done. You send it off. You get your answers. You get answers about well, the level of testing that you did, I always go for the top. If I can pay 20 more bucks, 20 more bucks and get you the best test that there is to offer, I'm going to do it. Okay. Because 20 more bucks is absolutely worth getting that other key piece because it's so important. Okay. But what's most important is that correlating labs with the symptoms, with the medical history. Okay. Because now I know you're going to benefit from that test and getting your answers, but let's take a look at what those symptoms were and what are the results. Are we answering questions? If not, what's still the missing piece? More than likely, we are going to get some great answers. All right, y'all, we have 3 more questions. Woo, here we go. Why am I craving sugar or carbs all the time? And that sounds like a probably they're not craving sugar and carbs all the time. It just kind of feels like the mind is always like thinking about sugar and bread and pastas and things like that. And I do because I have clients that say, I could care less about cake, but give me a piece of bread, give me some pasta, I'm on it. Okay, I get it. Just be mindful that hormone shifts can affect the insulin sensitivity, stress hormones, sleep, and all of this can influence your appetite and your cravings. How wild is that? You're like, well, then why do I feel the cravings like before I go to bed? How great was your sleep earlier? And did you need a nap? There are times when you absolutely need what I call brain breaks, where you feel like you are not scrolling your phone, but you're feeling like you can think about nothing. I know you're probably going to be thinking about when I go to the grocery store, what am I going to get? I hear you, but I'm just saying 10-minute brain break, turn on your timer, 10 minutes. This isn't lunch break time. This is brain break. You know how people got cigarette breaks back in the day? I mean, I would be like, okay, well, I'm going out too, but I'm going to go sit in a chair and I'm going to set my timer for 10 minutes. I'm not going to smoke a cigarette, but I'm going to think about nothing. And I'm just going to whatever I want to think about. That might be one of my most creative times. That's what I'm saying. How good is your sleep? Do you still need a nap? What in the world's happening? Because you might find yourself when you give yourself a break. I'm not talking about an eating break during this 10 minutes. This isn't snack time. This is time to just think about relaxing, letting those cortisol levels fall naturally like they're supposed to because we're not fighting a bear. There's not a mountain lion anywhere near us. We are relaxing. Okay. All right. Just remember that poor sleep alone can increase hunger hormones and it can reduce that satiety signal, that signal that usually happens when people take a synthetic GLP-1. They're like, and we're full. Just be mindful. That's a natural signal that should already be part of your body. Okay. But those are things that we can miss when we're exhausted. So stabilize that blood sugar. Take a look at things like protein, fiber, regular meals. Okay. I'm not talking clean your plate club meals. I'm just talking about regular, decent meals, not the um not the stuff in a box. Okay. Well, do I need supplements? Well, what do you need? What have you got going on? It depends on your diet. What are you missing? Are you vegetarian? Are you vegan? Are you pescatarian? Are you on the carnivore diet? What do you have going on in your body? What is your diagnosis? What do you need? Okay. Do you need something that is supplementing of what you're not getting in your daily calorie intake? Okay. What have you got going on? What's your medical condition, and what is your lifestyle? I feel like lifestyle should be part of right up there with diagnosis. Well, this is what you've been diagnosed with. We don't see anything going on, but what's your lifestyle like? Okay. That should be super helpful for you, because some nutrients become essential. Some nutrients, some supplements become very essential. Okay. So just be mindful that you want to support your bone health, you want your muscle health, you want your brain health. Okay. Get that individualized care. Now, this is the last one. How do I know if I'm feeling normal? Well, I don't laugh with teasing. I don't laugh with teasing. I understand. I used to see a counselor friend, and she was like, I really just don't understand why people want to be normal. What? I get it. Through her training, maybe she's seen and heard and done, but there are things in my world we want normal. We want normal blood pressure, we want normal blood sugar, we want normal pain levels, we want normal. We nurses love normal. Okay, we really. That's why I kind of give a little bit of a chuckle, because um, many symptoms are common, because many symptoms can be common because of what you're suffering through. Okay. Many symptoms can be common because of what you are suffering through. What is going on? What are those pieces? What is the thing? What is all the stuff? Okay. Because those symptoms can be common because of what you are suffering through. Do you suffer forever? No, we don't suffer forever. Okay. We want normal, we want happy, we want quality of life. I love that, those QOLs, because if something is affecting your quality of life, if something is affecting your sleep, your mood, pain, if something is affecting your energy level, your function, it is worth exploring. Suffering is not normal. Okay. Support is available. Ask the questions, understand your body, and say, this is new, and explore it. Ask the questions from the people who know. I have a couple of bonus questions, but I really feel like these are some questions about, my doctor says everything is normal, but I don't feel normal. Okay, well, let's have the conversation later about that. So, anywho, y'all, this has been super long, and I know that, but we are here. We're doing this. We've got this. You've got this. Okay. Make sure you get the information that you need. Make sure that you subscribe social media wise, Self Care University. Okay. If you need to go to my website, selfcareuniversityok.com. The O and the K is like Oklahoma. That's what that stands for. Self Care University. Okay. Make sure you check out the description. Get that link. Click on it. Get your consultation ready to go. Ask questions. If somebody's coming at you with supplemental information, what are the benefits? What are the known benefits? Is it third party tested? Okay. Get your inspector hat on. What do you see in this product and what do you hear in what I am saying and how this can be beneficial? Always a great question because that's advocacy. All right. Well, you have a fantastic day and we'll talk soon.